My name is Sarah Milligan. I'm with the Oklahoma Oral History Research Program at the Oklahoma State University Library, and today I'm talking with Heather Spiegel on December 21st, 2021. I have to write that down or I get it wrong every time. About her experience during the COVID-19 pandemic in Oklahoma. We're going to be focusing most of our time on her role in teaching and practicing with nursing students and related fields. Like, I know that it's larger than that, in southeastern Oklahoma. But I have more general questions that we'll talk about just life. So this project is supported through funding from the Institute for Museum and Library Services. There we are. So I like to start with just a little bit of background information. So if you want to tell me a little bit about yourself and like where you grew up, which I know you know that I know this, but I'm still asking where you grew up and a little bit about yourself and like how you came into nursing. And I think that'll be a good start.
Okay. I'm from McAlester, Oklahoma. I was born here and I live here. And wow, yeah.
Right?
I moved away for a couple of years here and there, but for the most part, here I am. My family's not from here. So my family were transplants to southeastern Oklahoma. Neither one of them are from Oklahoma.
Where are they from? I didn't know that.
My mom's from Wichita, Kansas, and my dad is from Shamrock, Texas, which is just about a mile into Texas from Oklahoma. I think he farmed cotton in Oklahoma. He went to a small school called Texola, which was Texas kids and Oklahoma kids. So he never claimed one or the other.
That's right off of I-40.
Yeah.
Yeah.
Because so they moved here in 78. My dad was a Singer sewing machine repairman and salesman. And there was a Singer sewing shop here that was up for sale. So that's how they moved here. So a lot of people around here have been here and their families have been here forever, but I'm a person here now, but they were not. Yeah. And so there's that part that people always assume around here, that you're from here and that you have all these connections, but they just transplanted here, and here I've been.
Your whole life.
Yeah.
On and off.
Yeah. So I grew up here and graduated school here and went to college, and that's where I decided I wanted to be a nurse, was when I was in college. I did go to Tahlequah to NSU first, but they don't have a nursing program. So when I was looking around for nursing programs and cost and everything, it was most cost effective to come back to Wilburton, which is 30 minutes from McAlester. But I didn't stay in McAlester. I lived the college life at Wilburton. And because they had a nursing program there. So that's where I went to school. Yeah. And that's where I teach now and where I have taught. So that's kind of special to me as well, just because I know how the people of southeastern Oklahoma work. So it's not a hard transition for me to understand our culture here. Yeah. So
you were a nursing student there in like the early 2000s, would that be?
I graduated in 2002.
Okay.
Just because I didn't have a major when I started college. And so I actually ended up with 2 degrees from Eastern, because if you hang around long enough and take classes, you just earn credits.
You're chasing that.
Yeah. And so anyway, I graduated from there and went straight to work at McAlester Regional. But I didn't take a full-time job because I was going to get my bachelor's at NSU. So I went back, and that's when I only stayed here like 2 or 3 months after graduation, and I moved to Tahlequah again.
I see.
And I stayed in Tahlequah for 4 years after that, working. So I worked at McAlester Regional, and I would drive back and forth and stay with my parents. And then I would work at Tahlequah City Hospital, which is now Northeastern Health Systems. But I did that. And then I would quit down here and just work full time there. And I just worked and got my bachelor's, and I graduated from there for my bachelor's in 2004.
What was your bachelor's in?
Bachelor's in Science and Nursing, BSN.
Okay.
So I graduated there in 2004, but I had been working since 2002 as an RN. And so when I worked up there, I worked a lot of different places in that hospital just because I was in school, so I didn't have like a set shift, kind of. I just worked when I could. So back then, I still say that a lot now that I've been a nurse a long time, but I would just say, like, I can work Friday night or Monday day shift. Like, I just worked all shifts or part shifts. They would just take me for 6 or 8 hours or 12 hours or whatever. So back then, we would come in the back door, the employee door, and a piece of paper would just be like taped to the wall, and your name would be by whatever department you're working that day. So
was that really common to have shifts like that for nurses?
I mean, most people were full time, so you were assigned. I wouldn't say it was super common, but it was smaller then. That hospital was much smaller when I started working there. And so I was trained. I mean, I was trained in every area that I went to. I mean, it wasn't just like random. And it was mainly med-surg, post-surgical. I did in-surgery and recovery room and then ER. And so, I mean, I could have probably went to ICU and taken care of some less critical ICU patients, but I never went up there. I did some when I went to ER, but so then I would just come in and work, and I learned what I liked and what I didn't like doing that.
What did you like and what did you not like?
I did not like surgery. That was not for me.
What did you not like about surgery?
The RN role in the surgery suite is different than what you think, like just in TV and movies. The surgery, it's like its own little dance in there. Like you have the surgeon and the anesthesiologist, and the scrub techs do a lot of all the work, what you would think of as the work part, the actual doing part. The RN does a lot of the pre-op, like making sure you don't have your jewelry on and you're not allergic to anything. And did you eat or did you not eat? What are your medicines and things like that? And then when they're in the OR suite, you're the circulator. So basically you're the historian, the documenter of everything that's going on. And you're not really doing the things in electives, not an emergency situation, but, and I just, my brain needs to be doing more, I think. And there's a culture to surgery nursing that is, you either just love it and you do it forever, or you don't like it, which is kind of with things in nursing in general. But
I think every field has that.
Yeah.
Yeah.
And so I did recovery room mostly because I just hated staying in the surgery suites. Like I would go do lunch for like people, because some surgeries like colon resections and major things, they take like 6-7 hours. So I would be a break relief or a lunch relief, which was fine. But recovery room, you would get a new patient in and out like 30 minutes an hour. And that's really a little piece to that to my future with hospice, is that's where I started giving a lot of pain medicine and like really understanding giving pain medicine and how people need it and use it. Their body uses the medicine to help them, was in recovery room. And so, and what surgeries would need more and what would not need more. And the one thing that I realized working in surgery versus just on the medical floor is that in surgery, the doctors are always there. So like if someone was in horrible pain, I could just go knock on the surgery suite and tell the anesthesiologist and they could give me orders. Like I was steps away from having a doctor at any moment. And when you work on the regular floor, you have to call, you have to do that. Well, back then, I'm going to say that a lot.
Back when pagers ruled the world.
Yeah. But now they have hospitalists and you have a doctor there 24/7. You know, we didn't do that back then. They were office Monday through Friday, and then they had different on-call schedules. And so, and then I fell in love with ER when they call it floating, but when I got assigned to ERs, I never thought I would like that just because my dad was sick a lot and I was in ER a lot when I was younger. And I just I don't want to be down here. And then I come to find out that I loved it so much. So that's when I graduated from my BSN and was like done with school, I took a full-time position in the ER. And that's where I worked until I came back to McAlester for 2 years.
So you stayed in the Tahlequah Hospital for 2 years working in ER?
Mm-hmm.
So what did you like about ER?
I liked all the new, like, you never know, which is great. I do think the important part is like the first 2 years from that 2002 to 2004, I did work mainly med-surg, like taking a group of patients, like 5 patients, 4, 5, 6 patients, and taking care of them like you would think of typical nursing type things. And so it was helpful to have that. But then with ER, it made a big difference, the doctors in ER, when you are becoming a new ER nurse, because they teach you so much. And I don't know how to really explain that. If you have a good team to teach you, you can do that type of nursing for a long time. And I just remember one specific doctor that he was just like, okay, like, do you know why we're doing this? Do you see why we're doing this? And what do you think? You know, he knew, but he just wanted my brain to think through it. And they really teach you. And when you have ER nurses that had worked there a while, they can say, okay, see this isn't as important. This is important. You know, and you just get that was the high of nursing for me, was because I finally felt like I knew enough that I could do what I needed to do and take care of the people what I needed to. And that was until now, but that was the most comfortable I felt. Was a year into that, I was like, I'm rocking and rolling. Like I could show up all the time. And so I really bonded with my friend Stephanie there. And her and I ended up being roommates when we were there. And I worked weekends. I did mid-shift weekends, which was Friday, Saturday, Sunday. And she did like regular day shifts. So she'd be 3 days, Monday, Friday, Tuesday, whatever, or a weekend day, whatever. But they would always call us because we were roommates and we did weird shifts, and they'd call us like 2 a.m, like, we're slammed. Can you come? I mean, we would just jump out of bed, put our scrubs on, we're like, woohoo! You know, we were young and just they needed us, and we loved it. We loved it. So that's what I remember about Hurricane Katrina, because they brought those
like finish this thought. Yes.
So Hurricane Katrina, I was working ER during that. And they brought bus loads to Camp Gruber in Fort Gibson, which is 20 minutes from Tahlequah. And they triaged them there because they didn't want to overflood Tulsa with all the major So they would send them to all these smaller hospitals, and then we would transfer them to where there was availability and who needed what treatment and everything. And so we just kept waiting because we never knew when the bus was going to get there, when they'd be triaged. And I remember getting that call. They called us at like 2 a.m. and they're like, okay, they're on their way. We're getting our first batch. And I don't remember how much we worked. I don't remember when I went home that day. I just know for days and days I would go clock in, and then I would go home and sleep as much until I woke up. Then I would take a shower and go back and just do it again. I probably wasn't a whole week before they triaged through all of them, but the first patients were really bad, and that's a whole nother story. But
so how long did you do that for? Were you just in that holding pattern and just getting up and going to work?
Probably 5 or 6 days. I mean, before they really got through everyone triaged and yeah, because I mean, I remember the sick ones at the beginning, and I remember the trickle down to people that were just not as emergent. But that was what we lived for. I mean, just to be called. we didn't have anything else to do. We were 25, 26.
Yeah.
And just working, and I loved it. I never hated clocking in or I mean, I did that solid for 2 years. I just ate all that up.
Yeah. So was that your first like larger disaster response? Was that Katrina?
Yeah. And I felt I had been an ER nurse long enough to feel confident in that. And so it wasn't mentally hard for me, because it was like, okay, let's do this. My brain knew what to do and when to do it, you know. Emotionally, it was a little rough, but
is that something that the people that you worked with also kind of helped mentor you through?
It's a whole separate section of nursing that I'm glad we have a long time to talk, because I teach mental health nursing.
Right.
And I don't remember specifically them having counseling for that situation. They could have. I just don't remember. Also, just because Stephanie and I were roommates, when we just wanted to just, bleh, you know, we just did it, and then we moved on. It may be 5 minutes, it may be 10 minutes, but there's something about in your brain when you care for people that are in their worst times. I tell my students, I'm like, people don't come to the hospital for fun with like things that change their life. They don't do that. So there's something about a nurse brain that switches to care for the people, care for the person. And it affects you. I'm not trying to say it doesn't, but like when you just get one every week, or one a shift, or one a month, you can process that on your own a little bit. And nursing, we have our own little coven or whatever, you know, that we can say, hey man, that was horrible. I can't take another patient like that right now. So, which is very common. It's like, okay, I just had this person who was in a massive car wreck, and their family, like, the next one, can you take it? You know, and which is fine when you have time in between.
Or enough people
to do
around.
that.
Yeah.
I do know that when I worked ER with, specifically, I remember Shaken Baby. We would have mandatory, I don't know about counseling, but like, I don't remember a official counselor coming, but like HR would come and we would sit and talk about how we felt about that, you know, and we didn't have shaken babies very often. I only remember one in the 2 years that I was there, but we also we were by the river, So the ones I remember are drownings that we would have, like mandatory group sessions to talk about our feelings, which in 2004 was like, okay, like whatever.
So the culture was that that was overboard at that point? Is that?
I felt like newer nurses needed it more than older nurses.
Yeah. Okay.
And just because, now that I'm older, I realize the older nurses need to be in there because, like, hey, yeah, that was horrible. But look at us. Like, we keep going and we keep think of all the patients that you have helped and all the patients you were able to save. And so you need a whole array of that. But the more that you've seen, not that you don't care.
Yeah.
But it's just like, okay, life goes on and you're going to have another patient that's bad. And so you care for them the best that you can and you keep going because people need you and they need your expertise too. You can't just drop anyone off in any part of nursing. Right. Like, don't take me to deliver babies. Like, don't drop me off there. I won't be of any help to you.
Yeah, I think that is a good point, like that reminder. And the river thing, the Illinois River, just for context, is right next to Tahlequah, and it's a huge, like, rafting, like social rafting.
Yes.
It's like there's a big industry and just a huge culture of, like, drinking and rafting.
Yes. And doing ridiculous things that you would not do.
Correct. It has a legacy of its own about it. Yes.
And then also, the college is there. My least favorite time of the year is August, July, and August. July for the river, August for the students coming because 18 and 19 and 20-year-olds, their prefrontal cortex is still forming and shaping. There's a lot of independence learned, and they have to come to the ER because they've made choices.
Yeah.
And so there's a little bit of a difference learning my ER things in that town.
Yeah, I could see that.
Because here at McAlester ER, which I worked as well later, like, I did not take care of one drowning. It's just, now car wrecks with Highway 69, yes. Yes, I did that, but I didn't do that in Tahlequah.
Interesting. Yeah. So that makes sense that every community has its own health stresses. So you came back to McAlester in 2004, is that right?
2006.
I mean, yes, 2006.
Yes.
And you worked in the ER here?
I came back because I had a position on Med-Surg.
Oh.
So I went back to nights on 3 South, and I did weekends again just because I like weekends and nights. And
so what made you come back to McAlester then?
My husband now. Mm-hmm. He works for FedEx, and he was in a contract. And we were trying to, like, drive and be together. And, like, he was, anyway, late nights. And then I didn't feel safe with him driving. And he didn't feel safe with me driving back at 2 a.m. or whatever. So I was like, well, I'm a nurse. I can move. And he couldn't for 3 years. He was in a contract. So I came back.
Okay. Well, that makes sense on why you
for love.
Good
thing we're still together.
Good thing that was the right move, it seems like. So you were here working in the hospital. So how did you get back involved with Eastern Oklahoma State College?
So I worked Med-Surg and man, am I going to say back when, like, every time?
Like, whatever.
So back then, in 2006, the internet was really just kind of beginning to take off. Like, at the end of 2004, when I went to get my bachelor's, you could do in-person classes or 1 week in person, 1 week online. Like, they still weren't doing fully online. And then the last year when I graduated, they offered online only in 2004. And so I did the last semester online only.
Mm-hmm.
And it was just because they were really just figuring out like webcams and like how to do more than email. By 2006, I was back here, and I was one of the only people with a bachelor's in nursing because it wasn't accessible. That was the word. Accessible to people in southeastern Oklahoma to get a bachelor's in nursing unless you drove to a campus.
Because Eastern Oklahoma is the only nursing program within probably 200 mile radius. And it's a 2-year, right? Like it's an associate
there
level.
is, there is Carl Albert and Podo. So that's 90 miles, but you'd have to go past Wilburton.
Is it a 4?
No, it's 2 years.
It's just also
and then
2 year.
Connors is at Warren, which is like 60, and it's northeast Oklahoma.
Oh, right.
And it's a 2-year.
Right, but there's no 4-year within.
Ada is the closest one.
Right, which is a couple hours.
And they were trying to grow the RN to BSN program, which nursing is very complicated in all its levels. The main thing is no matter if you go to a 2-year or 4-year, you still have to take the national licensure test. And I tell my students that all the time. It doesn't matter if you go to Oklahoma Baptist Nursing School or Eastern Nursing School or Tulsa University Nursing School. When you get done, everyone takes the same national test.
Yeah.
And so I only have 2 years to teach you that.
Yeah.
So, and I don't know the exact history of the RN to BSN programs in the state of Oklahoma. I do think NSU claims to be the first RN to BSN program. I don't know what year that was. But so if you went to Eastern to get your RN, to get an RN to BSN, I don't remember what year Ada started at RN to BSN.
I see.
So if you wanted a bachelor's and you already had your 2-year RN, you'd have to go redo your bachelor's and go through nursing school again because they didn't have an RN to BSN.
I see.
And I don't know what year that was for Ada.
Yeah. But until 2004, you couldn't do any of it online.
It was so hard.
Yeah.
And I do think Ada was trying to come to McAlester and do like 1 night a week. But then on top of that, you had to take chemistry. Well, they didn't have chemistry here. So then you'd have to drive to Eastern 4 days a week to get chemistry and then do it. I mean, it just wasn't conducive. And you had to work back then.
Well, still now, people working.
And back then you did 8s. We do 12s now. So to do 8-hour shifts, you have to work 5 days a week.
Yeah.
And to get 2 days off in a row, you had to work like 7 or 8-hour shifts in a row to get to, and it just wasn't conducive to get a bachelor's. I say all that because the ER department here had a trauma registry. I'm giving you lots of history about all these things.
I do think it's helpful because we'll get to why all of that setup
comes to now.
Right.
Okay.
Yes.
So Oklahoma, I don't remember what year that was, before I got there in 2006, found that hospitals could not care for people in traumatic incidences because they weren't usually insured, and they were out all this money for caring for them, and they didn't have an emergency set up. It was like, oh, head trauma, take them to Push County Antlers 1-bed ER. Like, that's the closest one. Like, there was no rules out there. So Oklahoma made the regional trauma boards. They set up all these policies and laws and these things. As if, like, someone's on the Indian Nation Turnpike by Antlers and you get in a major car wreck, you fly a helicopter in and you fly them to Oklahoma City or Tulsa. Like, bypass everyone. That was not the case before that. Those paramedics would just take them to Antlers. Well, then they would sit there. Then they would have to try to get a helicopter or another ambulance to get them somewhere. So all that was set up so that when I came back, the position opened for trauma registry in the ER, and you had to have your bachelor's and you had to have ER experience. And as far as I know, I was the only one who applied, and I was the only one who had that. Because tons of ER experience, but it was so hard to get a bachelor's. The other person that had it was the manager because, he had been in ER and had a bachelor's. So I did that for a year and a half, and you have to go to these things. You have to submit a lot. I did a lot of chart stuff because you have to prove that the state made a trauma fund to help these facilities take care of these trauma patients. But you had to input a ton of data. So anyway, I did a lot of quality chart checks. I taught the nurses how to chart, if a patient comes and falls off a ladder, you can't just say falls off a ladder. You got to say they fell 16 feet. They hit their hip on the way down to hit their head. I need a lot more detail or we won't get any money. So I did a lot of that in that. Because I was doing that, I started just in the hospital working with the education department because I had to also teach doctors, you have to put the right things in or we don't get this. Or you have to, and also medical records. If it's not coded right, then we don't get this. I spent a lot of time in medical records. So there's only so many office jobs in the hospital. So I just kind of ended up going to lunch with the education department and got to know them. And that's when I just decided, I was like, well, I'm going to get my master's. I'm not doing anything else.
That's how that happens sometimes.
That's how that happens sometimes. So
was it with the thought that you would move towards teaching, or was it really just because you thought that's just the next level of education?
I realized that I loved doing the education part in the hospital. And I honestly thought that I got comfortable just kind of when I was in the ER, and I told you after that year I just felt good. I liked going into work. I didn't feel like I had to ask people a lot of questions. I felt comfortable. I was on this nursing high. If I need help, I have people, but I'm the go-to person. People were coming to me and I know the answers kind of a thing. And so I got really comfortable in that position, and they started giving me a lot more responsibility, more than just trauma registry. I started, like I said, teaching the nurses, and I built rapport with the nurses, so they trusted me. And so I started building little in-services, here we have this new thing, and here's the new policy, and I'll teach you. And, I was oh, well, I'm teaching this. I'm a nurse teacher now. So I should just go. Well, at the time, OU, there was a nursing shortage, as there is a nursing shortage. But at that point, there was a nursing shortage because the nursing teachers were retiring. And there weren't enough nursing instructors that were educated to the standard of accreditation. Accreditation determines a lot of things. There weren't enough in the state of Oklahoma to accept enough students to get more nurses. So nursing student education was declining because there are rules in place with accreditation. You can only take so many nursing students per teacher. It's not like history class, oh, you can just keep shoving students in a hall for history class. 300, 500, whatever, if you can fit them, but not us because you have clinicals. You can only have so many students per whatever. So there was a grant that was through OU that you could apply for, and it was they condensed their Master's of Nursing Education program into 1 year for this grant. And I don't remember if it was a 5-year grant that they did it, but I was in the second or third class.
So is it just more intensive, or did they streamline things? Or
Oh, it was intense. So our class, we must have been the second starting class. We started in August 1st, but after that they started July 1st. But we start August 1st. You had a minor paper due on the 15th of every month and a major paper due on the 25th. And then they had to have them all graded and your input grade on the first day of the next class, or you couldn't progress.
Yeah.
And so you had every month you had a class. We had 2 classes that were 2 months because they had like more practical things we had to do.
Yeah.
But I just fell in that timeline. So I applied, I got accepted. I didn't get the grant. It was finance based. I was young. I didn't have college debt because I worked when I went to college. And then when I got my bachelor's, I was working while I went. Like, I just didn't.
Right.
And so I was kind of frustrated because it felt like everyone else got it, you know. But my dad was just like, just go do it. Which he was always just like, go do it. So I applied for that. Somewhere in there, I went to nursing education at the hospital. I left trauma registry, and I was not there like 3 months before I left. Mm-hmm. So I got over to nursing education, which is, I was put in charge of student education, I think because I was like 27 or 26 or however old I was.
Yeah.
And they're like, you're the new student coordinator. So you're in charge of coordinating LPNs, RNs, radiology students, like x-rays, ultrasounds. Now they have a lot more, but that was mainly who I was in charge of, making sure and getting all their paperwork during their orientation, making sure they had spots in the hospital. And so we used to have this big luncheon with all the teachers so we could work out schedules. Just so funny now that we would just do this like on a Zoom and a Google Sheet. You know, like there wasn't any way to share one document back then. It was like you saved it and you would email this large document, and then you would do your edits and save it.
Or you would all get together and sit down in the
same room. And you would all get together and
paper, calendars, or whatever. Yeah.
And that's what we did. And that's when I met the Eastern teachers. They were there. Mm-hmm. And a teacher put in her notice like that week that we had that luncheon in July. And they were like, hey, you should come work at Eastern. You're already in your master's program. Like, because you have to be in a master's program to be a teacher and for accreditation. I was like, well, I'll apply, but I don't have like any experience. I've never adjunct or any, you know, with college.
Yeah.
So I went over there and I did my little, you have to do a teaching thing and everything. I was like, this is crazy. And they like called and offered it to me the next day. And I was like, I have to give a 30-day notice and, you know, all these things. So I actually didn't start until like September, which is odd in an academic calendar year. But that's how I got there. Is I went from trauma to the education department to meeting them and leaving that position so quickly. Yeah. So here I am.
So you've been teaching nurses then
since September of 2008.
Yeah. So.
Yeah, 13 years.
13 years. Yeah.
This will be in 22 will be my 13th graduating class.
Oh my gosh. So what are some of the primary focuses that you specialize for the nursing, for teaching nurses?
Well, when I got there, the position that was needed was psych.
Mm-hmm.
So I did all the inpatient psych clinicals. I taught most of the psych nursing. My only qualification for that was working in the emergency room because we get a lot of psych patients before they go to inpatient psych. And so I guess that was my qualification. Teaching nursing actually is its own specialty, and it is recognized as a certificate of specialty in nursing. There's no way to understand that when you get into it. Teaching nursing is the hardest job I've ever had, the most rewarding job I've ever had, but you don't go to nursing school to be a teacher. You go to education school to be a teacher. So, like, you don't get all those teaching classes to know. And that's the hardest thing for a nurse. I've seen people over 13 years come and go. They think they want to come to teach nursing. Oh, it's a Monday through Friday job, and they don't stay because it's harder than clocking in and clocking out and taking care of patients. I keep talking about when you're in the groove, it's hard to get in the groove. I tell new faculty members, it takes 3 years. And if you can make it 3 years, you'll find your groove and you'll love it. But don't stay if you don't love it because it's exhausting. And families take a lot to live with nurses. It's hard on families.
Because of?
Because we take care of other people. I found there to be a weird dynamic of nurses. There's the nurses that will do anything for anyone and allow people to run them over, to lay down their life for anyone and everything, and they will suffer themselves to do that, which will come into play when we talk about COVID. Mm-hmm. So you have those that they just think their job is just to sacrifice all the time. Sacrifice not physically, but physically, emotionally, mentally, spiritually, just so that everyone else can have something like that. And then I find that there's nurses that I will take care of you and we will get it done. But you won't abuse the boundaries that we have either. And most of those nurses are critical care, ICU, ER, because they see that kind of, patient. But most nurses that are the sacrificial lay down, they can't make it in critical care areas because they will suck the emotion. They cannot continue.
When there's continued trauma and continued just big events, then that's sort of what I'm hearing.
They just kind of
get pulled into it.
Yeah.
Yeah. I can see that. Okay, well maybe that is a good segue to kind of pull back in. So so you've been teaching for a long time. You've been primarily teaching. The other thing that you sort of referenced, but maybe we should actually more explicitly state, you also work with one of the hospices here in McAlester, Heartland Hospice.
Oh, yeah.
Right? And so that's in addition to are you the case manager? I'm not even sure.
No, that's okay. So when I said that you don't go into teaching nursing you're a nurse, you're not a teacher, you're so when you go and you do classroom work, sometimes your mental brain, your nurse brain is like, I'm not taking care of patients. Mm-hmm. And so I've come to realize my students are my patients, but that's a side note. So when I got this job, I stayed on at the ER for till 2014. So back then, to stay on, you had to work one shift a quarter or one shift a month. It changed depending on policies and stuff. So I worked ER once a month, if not more. Usually Christmas break, summers I would work because people would go on vacations. I did that until 2014. And then I took a year off because my dad was not well. And then it was my dad that I was like, I can't go back to ER. Like, I just can't do that. So my friend that was my boss in education had went to hospice. And she was like, just come try it. Like, it's a different pace. It's a different thing. And you've just taken care of your dad. Like, here we are. I was like, all right, well, I'll try it. Because that's what nurses do. We change around and do different things. So I went over and they're like, oh, yeah, we'll hire you. Okay, I will. Okay, all these hirings seem real simple when I walk in. They're like, oh, you've been a nurse for a long time? You have your master's in nursing? Okay, sure, we'll give you a job. So
you started in around 2014 working.
15, yeah. I think I started in 15.
Yeah.
And actually, I recently just quit 2 weeks ago.
That.
Well, you wouldn't have
Why
known
would I
that.
know that? Yeah.
Yeah. Which has to do with COVID. So it just brings us into full circle.
Yeah.
So then I started doing once a month on call. I did that for 4 years. Once a month, I would take 24-hour call and take care of hospice patients, which I was just like, oh yeah. Well, I loved hospice patients just as much as I loved ER. Mm-hmm. And I don't know how to explain that. And maybe it was because I was teaching, because a lot of hospice is just helping families. Mm-hmm. It really is. It's teaching them and just making sure, and part of the ER part is you're advocating for your patient and what they want, not what the family wants. And so I feel probably too confident in going in and just telling families, like, listen, here we are. Yeah. And because of my own experience watching my dad be sick my whole life, mm-hmm. We were a family who talked about those things. And so nothing seemed uncomfortable. I never felt uncomfortable. And then in emergency situations, you just have to talk to families and say, hey, this is what it is. Mm-hmm. And I know that it is a lot. And decisions have to be made, and it's not fair. I'm sorry. It's not. So, yeah, I did hospice, and I took care of patients that wanted to do dying their way, which is my favorite thing to do, is to help you do it your way. Because that's what I want. I want to do it my way.
Yeah.
Yeah. So.
Well, and I think what I understand is that while you were teaching, you also wanted to stay in practice because.
Oh, yeah.
That was also feeding your.
Yeah, it's in me.
Yeah.
I don't know.
Yeah.
I don't know. And I may, I think this year I will take off. I can't imagine not doing something else. So we'll see what the future holds.
Yeah. Well, let's, so bringing back to rolling into 2020, right? I know. But that's also why we're here.
I know. It's why we're here. Just,
right, so rolling into 2020, you were teaching. I know this because you and I have had a conversation. Yes. You were teaching that semester, and you had training nurses and mentoring nurses doing their clinicals yes. and all this stuff. So maybe talk to me a little bit about at what point you kind of realized something is happening here and it might be bigger than
Oh my gosh.
Right. Like it might be bigger than what.
Is this what
we've had.
everyone does when you talk about COVID? I'm just like.
It's a natural reaction. Let me just say that.
Okay.
It's probably more intense for you.
It is very intense for me.
Mm-hmm. Yeah. I mean, it's a life altering point for most people, right? Like but especially in healthcare, I suspect.
In healthcare.
So you were teaching.
I was teaching, just going on at that point that I had been here. Let's see. 2020 was my 11th graduating class. Mm-hmm. So I've been here 11 years. At this point, I had been sophomore coordinator I think I started that for 9 years. I was over the whole second level.
Which is basically their graduation point, right?
Yes. So it's a 2-year program. I'm the sophomore, I'm second year. And so I've been in charge of sophomores for 8 years. Like part of me, when we get new teachers, I kind of feel bad for them. I have a whole list. I just made a list to check off because my brain has done the same thing over and over. Mm-hmm. So I'm just cruising through February. The one thing that has changed because of politics is that they drive me crazy. And so, I don't watch news anymore. I can't.
For how long? Was this
probably
before?
2016. 2016. In 2012, I was having babies and I didn't have the mental. I was just watching The Office reruns, for just Mm-hmm. But 2016, I was like, this is not worth I have other things. Anyway, you need to know that part because when 2020 came, if you bring up political things on Facebook, I love you, but I hide you. Because I'm trying to raise children and raise nurses. That's what I do every day. So, all that being said, I didn't know. I didn't know about coronavirus as much as one would think that I should. Just because politics makes me mad, so I don't watch the news and I don't get on Facebook. I turned off notifications on my phone for Apple News and USA World and anything that has to do with that. I get my emails with my journals and my, just things that are going on. I want to say updated in healthcare. Mm-hmm. I don't remember that showing up. That doesn't mean it wasn't there. Mm-hmm. The first thing I just remember kind of vaguely, the beginning of March, was they started shutting down airports. I probably knew more because I am the international faculty advisor, and we were supposed to go to Denmark in May. So I knew more in February about it because airports were being shut down and we were trying to figure out if we were going to Europe or not. Mm-hmm. Not thinking about southeast Oklahoma. I was like, these things are going on out here, not here. Mm-hmm. And okay, so I'm rock and rolling. I'm also doing this Denmark humanities class, teaching, meeting. They have to learn things about Denmark, and they're asking questions, and I'm like, I don't know anything. I don't make those decisions. The president cancels international trips and international travel. Mm-hmm. My thing, even with healthcare, is you keep going until someone tells you you're not going. Mm-hmm. So I even left spring break that year. Just going, well, surely it's not like a thing.
Yeah. Well, and for the context too, around spring break, it's like that's when people were just starting to say, like, you know, like how wide reaching is the impact, right? That was the point where I think publicly it was just sort of starting to hit the news cycles of like,
Mm-hmm.
there might be like, you know, like organized efforts to try and deter this, right? So
Yeah,
even
I
at
just
spring break, you're just
yeah, I just remember New York City.
Is that where you went?
Yeah, no, I didn't
Oh.
go there. I just remember that's my first part with the news is like New York City was getting it. And there's an Instagrammer that I follow. She lives in the city in New York City. She has autoimmune diseases. And that's when I was like, she's really sick. And her husband, I follow him on Instagram too. And he was like, she's been in there. And now they say there's, you know, this coronavirus. And then back then, we didn't have COVID testing. It was just like so foreign. But I think, which is so strange now that I think about that, is that it was Instagram that I really realized because I follow a bunch of people from not Oklahoma on there just to get my brain to have bigger views. Mm-hmm. And I was like, oh, that girl's sick. Like, she's sick. And I thought, okay. And then spring break came, and that's when a facility, our students do interns for their last 5 shifts, and we don't go with them. Mm-hmm. It's a contract they make. So we had a hospital contact us and say, your student can't come on spring break. Like, we're not letting anybody in except essential workers. Do you remember that word? Mm-hmm. Yeah. That is so strange to me now. I mean, the word essential was just like being thrown around. And I had to call my students that had planned. I was like, you can't go. I'm like, well, when are we going to go? I said, 2 weeks. The infamous 2 weeks. 2 weeks. Oh, man.
Close the classrooms for 2 weeks.
2 weeks.
Businesses for 2 weeks.
Right? Yeah. So then we get an email from the president. He's like, okay. They had lots of meetings, I'm sure. Mm-hmm. And I don't remember what came first, but it was something along the lines of, you know, like, can we do online? Do we have the resources? And what would our students need to go online? Like, what do we need? I'm thinking, nursing students don't take online tests. Like, all my brain was like, nursing students don't graduate nursing school unless they're going to the hospital to do nursing things. Like, like all these things, I'm like, how can I graduate nursing students and not take them back to the hospital? They're about to graduate. Like, this was very prime nursing stuff. Spring break is always a turning point for me. Now that we're going into spring semester, I always think about it, but it's right when they're like, oh my gosh, in June, I'm going to be on my own with my license. Like, they really dig in spring. I mean, you can just see it. They're like, oh my gosh, I'm going to be on my own. Like, I got to get it together. And they really push. And after spring break, I just really, I just love them so much. And April, they learn so much, and they just take a lot more responsibility for what is actually going to be their profession and their career. And I just love it. I love everything about it. And they're asking me, like, how to do online nursing school for a practical applied science where I need them to touch people and interact with people and be people. So my boss called and she's like, we got to do this. And I'm like, I don't 2 weeks. I'm not doing this. And so they said, they cannot come back on campus. You have to develop. We're going to give you an extra week of spring break to completely do everything. We didn't even know what Zoom was. The only thing that was my saving grace at that point was our campus is, I don't know what the fancy Google is, Google management. Like, our email is all through Google. We have Google Docs and Google Forms and Google, like, we had just went to that like 2 or 3 years before that. And Google Meets, like, Zoom was this business foreign like thing. And a lot of my students are young, but they're also young parents. And their kids were, and I had kids. Out of the teachers, I was the only one with kids at home. We had another teacher who had kids in daycare. I take that back. We had one teacher at Ida Bell, and she has one daughter, and she was like 12. I mean, it wasn't.
Your kids are in elementary school.
Oh, yes. I had a son that was in first grade that year and a son that was in third grade. And my husband works for FedEx. I just felt so overwhelmed. And I felt overwhelmed for them. Mm-hmm. Like, if I'm overwhelmed, they're like, we won't graduate nursing school. We've done all this and we have 9 weeks left. I said, oh no, you're graduating nursing school. That's what I kept telling them. Every time they would like have this moment, I was like, oh no, we're all graduating nursing school. I don't know what it's going to take, but we're all getting to nursing school this year. I don't know how many. I initiated a lot of plans quickly. That was what seemed most important, is to not let anyone drop out. Mm-hmm. So we had another thing for reference just for this is that nursing school at Eastern Oklahoma State College is on 3 campuses. We team teach. So Wilburton, Ida Bell, McAlester, all on the same plan. They share 3 teachers. And we used a Polycom. It's basically Zoom. But at that point, we didn't do that.
But you had access to the Polycom system.
Yes, right? But we didn't have Polycom at home. And
right, Polycom is like a specific like camera on a specific
like
room-centered space.
They're their own company, and you have to use Polycom equipment to do Zoom, basically.
Right, to do web conferencing.
Yeah.
Yeah.
But now I don't think there's even that. Now we use Zoom to do all that. Mm-hmm. We use Polycom equipment, but we have a Zoom. They must have made a contract. So I just remember telling the other teachers, because I'm their boss, and I'm like, okay, make a Google sheet, and we're going to call them. I don't think you should call them every day, but you're going to have to call them twice a week. You're going to have to log in here that we've communicated with them. We're going to email them. Anything you can think of, we're going to do it, because they're going to have a breakdown, because I'm about to have a breakdown. So they are the reason we're here. And we're going to get them through this, and it's going to suck. Like, I was just like, ugh. And remember when I said families and nurses? My husband would get home from work because I'm here with the children. I am scared to take them to my mom's house. I'm scared to take them to my in-laws. Nobody wants to take anyone anywhere because we don't want to spread it. Because if we just do these 2 weeks. So then the school system for my kids gave them an extra week, which was great because then I could just like do as much as I could. I spent so much time doing virtual clinicals, making virtual clinicals. I had to count how many hours like it would take them to do all these virtual clinicals. I had to detail it in Blackboard, like what counted, what didn't count, what was pass or fail, I made a whole new curriculum in a week. I made a whole new curriculum in a week. And I was so tired. And in between that, I'm calling them. I'm like, do you have internet? Southeastern Oklahoma
Doesn't even always have cell phone signal.
No.
Right.
So I haven't thought about this in a while. We had to call every student. We use Google Forms a lot. Do you have internet access? That's good. That you think you could take a test on and it not kick you off. Do you have a laptop with a webcam? Because a lot of my students have Chromebooks just to get them through because we're in a very poor socioeconomic population. Like, it's not like they have MacBooks here. I don't even know if I maybe have one student that has a MacBook. Like, we don't do that here in southeastern Oklahoma. It's just not a thing. I don't know how many webcams we had to find. And you could go on Amazon and they were just selling out. You couldn't go to Walmart. You couldn't do anything to get a webcam, so we had students, they had 9 weeks to graduate. I remember them spending ungodly amounts of money just to get like Wi-Fi extenders and do anything so that they could graduate. It was a big, huge expense to people who didn't have expense to expense.
Did the college have any resources they were able to?
So the libraries got together and they got as many webcams as they could, and they would check out webcams. They would check out laptops. It was much easier for the Wilburton campus, the main campus. They boosted all their Wi-Fi. You could sit in your car anywhere on campus to do that. McAlester was probably second best. They try to do their internet better. The way the campus is set up is a little bit hard, but if there were too many people that would come test in the parking lot, then the Wi-Fi would go down. I was like, go to the library. I had people come take their tests outside my house.
Just come and
to use my Wi-Fi at my house. And they were all sharing, like, come sit at my house. I live in town on Idabel. So many of my Idabel students live in the country. They have satellite internet. Even they're in town. There's kind of a monopoly down there on one internet business, and it's not that great.
Mm-hmm.
And
so the public library systems help with that some too. Like, could you go to the parking lot of the public library?
Oh yeah.
Or were they shut? Yeah.
No, they would, but so was everyone in elementary school and everyone because at that time the school systems didn't have their Wi-Fi boosted either. So the school did help. We had one kid who didn't have a laptop or any computer. He only did all his work at the school. So I remember loaning him out one. And then
one from the school or one yours? One
from the school. And then what was I gonna say about that? Oh, the school jumped on how are we gonna online proctor all these students? We didn't do that at Eastern. They had a year before that done Proctor U, and some teachers had piloted it. It.
Yeah.
And so a few teachers had that, and it was like, what are we going to do for all these students who we used to use paper proctor forms, and then they would go to their, I will say COVID pushed us into technology quickly, but the school was very good to do that. We have external testing systems that we do not use Blackboard. We do not use HonorLock. We use certain testing systems that make sure that we're on point with national standards, because we don't just want to teach for here, because this is not the test they're taking. So we had to get funds, which is hard with the state. You're like, I would like an extra $10,000. No. But they would not let us use HonorLock or Blackboard to give their exams. So for ATI testing, we had to get emergency funds through the president's office to pay for their proctoring
for the national standard
for this other website. So I would just call my boss, and I was like, this is what I need. And everything was just coming so fast. It was like I'd get an email from this national, you cannot not proctor. You cannot just which I understand, because the internet, they can screenshot all their stuff and just post it on Quizlet or post it on whatever. They're like, do not give our proctors exams if you're not in a proctored setting. And they were rushing to get a company to take care of their stuff. And because their very first price was ridiculous. I was like, I cannot ask my boss to ask their president for this much money, because at the end of the year we have 3 of their exams, and it was like $50. It was $150 a person. And so I think they knew right off that people were just going to let them take the test unproctored if they charged that much. So I mean, it just dropped dramatically. I think it ended up being like $10 a test or something. But they were coming out the gate with that. I'm like, we're taking this test no matter what. So we've got to find a solution. But those were the things that were right in those 2-week periods. Internet, which still was not good in some parts, and technology and webcams and laptops, and then everyone in the world in Southeast Oklahoma who, I mean, we're on the internet probably now more, but even then, everyone bogged down the internet. It was so slow.
Yeah.
But that's what those first 2 weeks that we didn't have class were like, trying to figure out. And then we just did it.
Did everyone graduate?
Everyone graduated. We did it. And so they go their whole, it's my favorite day. They go their whole nursing school, and they have this big pinning ceremony, and they wear their white scrubs, and their whole family comes.
Yeah.
And nobody goes to nursing school alone. It is, everyone must suffer.
I think you've mentioned that once or twice.
Yeah. And so it's where they show their kids, like, when mom couldn't do this, this is what we were doing. And all the parents and friends that made dinner and got kids where they needed to go, or the person you called when you're like, I'm quitting nursing school, this was the biggest mistake I've ever made. Those people show up. So it got to pinning, and they had made it through this. No one even remembered the other year and a half at this point. They're like, so the last 9 weeks, we did it, and we weren't allowed to have pinning. And of all that part of taking that away, was the hardest. I even remember I was like, students, if you have anything that's happening, you have to tell me. Well, one girl was like, I cannot take my test with my kids. We found her a babysitter in COVID whose mom would allow her to go over during COVID and watch her 2 kids while she took a test in her closet. I mean, these are life things, not technology things that you have to work through. And I just told my boss, I'm like, we cannot not have pinning. I don't know what it's going to look like, but we cannot not have it because, by God, we're having it now. Of all the years, we're having pinning today. And she's like, I'll ask the president. I said, you can ask the president. I mean, that sounds like what you should do. But no one has ever went through this in nursing school, and no one's ever going to go through what they went again. So we don't get to take this away from them. Well, we had parking lot pinning. That's what we called it. Every campus had their own parking lot pinning. And to this day, it's my favorite pinning I've ever been to. And we had them in front of every nursing building. They lined up 6-10 feet apart. Their families made posters, and there were balloons, and we pinned them, and it was the most beautiful pinning ever. And they honked their horns, and they were just like so happy. And then at the end, they all drove through and honked for all of them. And I thought, I cannot imagine had we not done that for them. Mm-hmm. And then I let them go work in COVID. And that's the whole, are we like running out of time?
No, we're actually fine. If you want to take a pause, we definitely can, because
I just need more water.
I'm really happy that you were able to pull all that. Let me just say that too. Because obviously it was meaningful to you, but I know it was meaningful to everybody else. Because just to even frame some of that period of time, I think the general feeling was just, I mean, it's hard to describe, right? Like, because no one's ever, like you said, no one's ever lived through this uncertainty day to day, and the fact that we're told to stay home, and we're told to, like, not talk to people, and and start doing all these like weird calculations of a pool noodle away from someone, right? Like,
yes.
And no one knows if those things are right. It's reactive day to day on what we can learn, and it's changing every day because
every day
the information we know about this public health crisis is changing. So I think your point too, and then I sent them to work in COVID. Like, that's a retrospective look, right? Like, at the time, I'm sure, I don't know how much you were talking to hospitals because your students weren't doing actively in them, but were you still working at that time in those spaces?
I was still, so I was working hospice up until then, every month, basically.
And I know this because my dad went into hospice at the end of May in 2020.
Yes.
And you were there.
I was helping him.
And that was amazing and crazy. And
it was.
Yeah.
It was. So hospice, they called me. I think I worked I feel like I worked the first weekend of March in 2020 for hospice.
Oh, okay.
Because I was still working once a month. And for some reason, I have that in my brain. Because I think I worked the last weekend of February and the first weekend of March. It was like I don't do that. I did not plan that well. But no, I know I did. Because our anniversary is in March. And my 40th birthday was in March. And I was going to... That makes me sad every time.
You didn't get to do your 40th birthday?
I didn't get to. I had a big... it was going to be big. I'm big, extroverted, loving all the people, doing all the things. So I had 2 weekends for my 40th birthday that year and our anniversary weekend. So I know I worked hospice that first weekend in March that year. And then when everything went down, I said, don't call me for April. I am.
Mm-hmm.
And then I was like, don't call me for May. Like, I think I need a break from what just happened. I don't know what just happened. Like, my brain is like, I don't know what just happened. I feel like May, my brain needs to do that. We had a big trip, a family trip to Utah planned. We didn't get to do that. People were like, why don't you just go? I said, I don't know which state has mask mandates and which state doesn't have mask mandates and which county. I mean, back then it was just like, well, this city has a mask mandate, but this city doesn't. I'm like, how do you travel?
So how would you have made that decision? Like, if there were blanket mask mandates, would you have been more safe, or was it like where would you fall in at that point?
Part of me just, I'm not saying it's right, but part of this goes back to me being an ER nurse. I've worked cold and flu season. I've taken care of TB patients.
Mm-hmm.
Like, don't cough in my face or breathe in my face. I'm like that with my children. My hand washing and hand sanitizer routine has not changed during COVID because it was that way before COVID.
Right.
Like, I remember flu seasons, my husband would be like, are you going to work ER? I'm like, yeah. I wear my mask when people are doing that. I wash my hands. I basically come in, strip down at the door. I don't carry any of that in. I'm very meticulous about that because respiratory illnesses are here. So part of my thing with COVID is like, I'll do my time, like, until we figure this out. I also understand, like, this is a thing. Like, I'm catching on, like, but if we can get through the season,
Mm-hmm.
like, we'll do it. And my biggest thing was finding a mask that I liked that I could wear for a long time.
Mm-hmm.
I had never worn it for a long time. But wearing a mask as a nurse is not too far off. And when you work surgery, you wear a mask the whole time you're in surgery. So those parts weren't too bad. Is that what you're kind of asking? Like, just kind of falling in with
but like
quarantining and
like did you feel like that, because that's something you already were processing on a day-to-day because you're exposed to respiratory illnesses and you already know, like, you wear personal protective gear,
Yes.
you wash your hands, there's already these things we know sort of protects us from that. Did you feel like all of this sort of like everybody needs to stop and everybody needs to wear a mask and everybody needs to start doing this? Did you feel like that was the sort of like right thing to do, or did you feel like that was overboard?
Oh, I felt like it was the right thing to do. And I wish that we did that in flu season. I'm like, so if we're doing this now, then maybe in flu season, no, it'll be normal. It just didn't really seem
So was it hard?
too bad.
Was it hard to think about traveling because you didn't know if you were going into a community where it was like hostile for masking and hostile for no?
No, just my thing is we were going on a national park outdoorsy thing. So my main concern is I don't want to just have to. I have thought so much and my brain is so tired. It really had to do with my brain can't do all the planning for the trip, the trip was not like a go there and stay for a week. It was like go to different places every time. So I would have to figure out if that place we were staying had these restrictions. If we were in Arizona, do they have this? If they're in Utah, then we come through Colorado. What are they going to be? Okay, well, this hotel doesn't require you to do this, but this Airbnb, it was mentally, I just like, my brain's done. We're going simple. And that's the week we took the Northwestern Oklahoma State Parks tour. And they were so happy because we had been stuck at home. And that's what I did tell my husband. I'm like, we have to leave. We have to leave.
Yeah.
I have to leave because this is not my life. Staying at this house, I don't do that. And he had to keep doing FedEx. Like I was more worried about him getting it just because he was out every day. Not one day did he miss work. Not one day did they stop delivering. It only increased. April of 2020 was busier than December of 2019. People were getting their toilet paper, their paper towels, their shampoo, their everything. No one went anywhere. And so he was gone and we were here. So anyway, Northwestern State Parks. Southeastern folks don't know much about up there. And now we do.
It is like 7 hours away. Though,
it is so far away. My son had a state parks book and he was like, Mom, we haven't been to Black Mesa. I'm like, no, and we're not. Like Black Mesa is a whole nother like state. It's like a whole nother.
We could just go to Colorado by that point.
I know. Like, no, sorry. We're not going to make Black Mesa this week.
Did you make it though?
To Black Mesa?
Yeah.
Eventually when we came back from Utah when we went this year.
You know the state parks there.
Yeah.
All right. So you kind of found ways to decompress off of that. But I think, and again, that setting at that time, right? Like, so businesses, part of that messaging was stay home because the hospitals are overwhelmed, right?
Not yet.
Oh, that's true. It wasn't at that point. It was, we're trying to regulate, we're trying to contain this.
Part of why we didn't go in April was not because COVID was in our hospitals here in southeastern Oklahoma. It was not. First of all, we didn't have tests to test people. True. A COVID test, I mean, I know that people had COVID and we didn't know it because we didn't have a COVID test. We didn't have anything to test antibodies to know.
Yeah.
And
which that was like April, they started becoming a thing, but they weren't an available thing.
I feel like when they first came out, and I wouldn't know, but I think in New York, they started doing blood testing. Mm-hmm. They were doing it before the swab.
I have a weird timeline that nobody needs it, but on it.
But the hospital that April started laying people off. They stopped elective surgeries and no one was going to the hospital. All the physicians and all the clinics started trying to take care of people in their homes. Telemed blew up. It became so available. All the insurances, even my husband's insurance, even mine, it was like, listen, we have this online thing. If you have an earache or you have a, whatever it is, just call this telemed. It's covered. Don't go to the hospital. It was all about don't go to the hospital. Well, which was true for New York. And I don't know why I know more about New York than LA coastal wise, but New York, that's when they sent the big Navy hospital carrier. One of the nurses here, her son was on that. I think probably because I just saw her post on Facebook and stuff. Mm-hmm. But they had to lay off so many people at the hospital because no one was there. Like only if you fell and broke your hip and you were going to die. Mm-hmm. And so April, May, June, they were just trying to keep office people in there to like check temperatures at the front door.
Yeah. I can say from a personal, and this is again related to your help with the hospice, but with my dad going into the palliative care unit in Muskogee, my brother and I were one of like maybe 5 people who were allowed to go in the hospital because,
Nobody
because
was
of the
let in.
palliative care.
Yeah.
So, and that was even sort of a surprise. You weren't allowed to go in if they were,
Uh-uh.
and we walked in and literally there's a person at the front door, took your temperature, handed you a mask, and you walk in and there's nobody. There's nobody in the lobby. There's nobody in the elevators. And then you step out on the floor and there's like the nurses and the patients, and that is it. And it is surreal, right?
It doesn't make sense.
Yeah, it was surreal.
I mean, it makes sense why, but I mean, like your brain.
Right. It felt like post-apocalyptic, right? Like just.
Yeah, it wasn't normal.
Yeah.
And at that time, there's so many patient stories, and just even non-COVID, like women went in and had their babies by themselves. Their husbands weren't allowed.
Mm-hmm.
And I just, like, as a human being and as a world that we're living in, I cannot imagine that. I can't imagine on the nurse side telling someone that administration says that you can't have anybody with you except strangers while giving birth to your baby. So not only for the patients, but I'm always looking at the nurse views. The labor and delivery nurses went through a lot of things telling people that they couldn't come see their new baby. Mm-hmm. They couldn't, and there are birthing emergencies. And so you don't want phone calls about your wife or your significant person alone while your new baby is alone in the nursery. Like, those are the nurse side stories that are a whole nother story.
Yeah.
So the hospital was empty. You couldn't get anyone. And that's when hospice got so busy. Mm-hmm. Hospice care, and they were calling me to work, and I'm like, I can't mentally work. I can't give any more than I'm already giving.
Yeah.
And people were staying home to die, which is what I think in the end was best, because they could have, what changed the game is no family could be with anyone.
Yeah. You knew that if you sent someone to the hospital, mm-hmm. that you were most likely never going to see them.
Yes, and that they would die alone. Well, the nurses would be there, but that's not your family.
Right.
And so, like you said, I remember your brother calling and being like, I'm trying to get I'm like, no, don't. Because you need a social worker. You need people. Because right now, the people are the only ones who are going to get it done.
Yeah.
People who have worked in healthcare long enough to know who to call and what to call to get things done. Because if you didn't have that information before 2020, you could have not wiggled your way through all, like you said, daily, like today.
Yeah.
I'm very glad you got to go see your dad. But there was probably some moments you were like, I don't know. I remember when your dad went on the ambulance.
We thought that was it.
And you thought that was the last time you were going to see him. Mm-hmm. Because you didn't know. And people were doing that all over the world.
Yeah.
But when they were going on hospice care, they were taking their family members. And so many people don't feel qualified to take care of their family member in the home. Very normal. Very normal. But I do see a shift now. Used to, before hospitals, all the family took care of those who gave birth and those who died. And so it wasn't abnormal. And I see that shift, that now these family members have helped and they feel empowered to take care of their family members again. And a weird shift,
Interesting.
So that changed, and the nursing homes were hard on hospice. Hospice is in the nursing homes. And that was rough. Go ahead.
What was rough about it? Like what?
Because these hospice nurses have relationships with these families. I will say most of the time, if they're in the nursing home, they're there for a long time. And so they've built this relationship, and now they can't even go and see them unless they're actively dying. And so it's just as hard for the nurses not to see their patients that they see. And they don't know if they're doing okay. And the nursing staff in the nursing home is overwhelmed, and you know that. And so you're like, I just want to go see my patient, make sure they're getting taken care of.
Yeah.
And you can't. So I would say hospice, and I wasn't even mentally there, but I do know from all the people I work with that the whole rest of the year 2020, taking care of patients at home, at the beginning, non-COVID, just usually you would take your family member to the hospital and they'd die in a couple of days or whatever. But then the COVID patients started coming on hospice. And then you have a whole nother level of their family caring for them and the hospice team caring for them.
Knowing that active COVID, that contraction.
Yeah. And they're going to give it to their family members, and their family members are going to come see them. Mm-hmm. And they have every right to. But at that point, it's like, how much is it spreading? How much, can you leave there and get in your car and go to the grocery store? Can you, do you need to strip down everything? Is there, there were so many questions. And I remember doing my supervisory visit, which is always in the fall. I did it in 2020 in the fall. COVID wasn't too bad when I did it October, November. There was some, but to go into a patient's house with the face shield, the face mask, all the PPE, the gloves, and I didn't have to do that very often. Just thinking about all these COVID nurses in the hospital in full gear was just too much for me to think about too long. So that, and one of the reasons, so then we get a new class.
For fall 2020.
For fall 2020. And the accreditors and the Oklahoma Board of Nursing were pretty flexible compared to other states. There are some students that didn't even get to graduate because they would not accept virtual clinical time in different states. Mm-hmm. And so there were people out there who didn't get to take their national licensure until this year when they should have taken it. Yeah. Our biggest concern in southeastern Oklahoma was that we wouldn't have enough PPE for the students, and they were using all that they had on the nurses and the patients they were taking care of, which we completely understood. So going into fall of 2020, we wanted clinicals for the students so bad. And I typically do psych inpatient clinicals, which are day shifts, or night shift clinicals at McAlester Regional. And they weren't letting us in inpatient psych. It's very tiny. It's 15 unit, and you just can't afford to let 8-9 extra people come in there. And we didn't have vaccines in fall of 2020. And this is when COVID really started picking up.
And that second wave, what sort of referred to?
Kind of first wave for Oklahoma. I think if I have a good timeline, the major Oklahoma really peaked in December of 2020. Mm-hmm. It was picking up towards that, and a lot of my new grads went into critical care, which is not typical because there wasn't anybody on med-surg. Mm. There were patients because they weren't doing surgeries, and people that would have had pneumonia before are going into their doctor's offices and doing shots, or they were doing outpatient IV antibiotics that usually they would have come in and stayed Yeah.
Yeah.
I mean, the medical field changed. COVID changed medicine.
Mm.
We're doing telemeds, and you're doing things that people would be in the hospital for that they aren't.
Yeah. So it's adjusting like everything you can to try and keep someone at home.
Mm-hmm. And I don't know about home health because I don't have a lot about that, but I know that it had to be overwhelming for them.
Yeah. So your students that graduated in spring 2020, they overwhelmingly entered critical care jobs. And were they pretty much all over southeastern Oklahoma? Did they stay in the region? Did they go other places?
Our Idabel students usually go into home health just because their hospital's small and there's not a lot of positions open down there. So that was kind of that.
Jobs.
They do go to Paris, Texas. A lot of them go to Paris, Texas. Some go to Texarkana. I think that year we had a lot of OB for some reason. Going to OB, but not really a lot of med surge. Now for our Wilburton students, a lot go to Fort Smith, Poteau, Talahina.
There's a VA hospital there, right?
There's a VA long term.
Yeah.
It's and then the Choctaw Nation tribal is where they go. The Choctaw Nation does not have ICU. They are ER and a med surge and OB. They have a very large labor and delivery, and it's wonderful. They have tons of midwives and very nice facility.
I forgot that was in Talahina.
Yeah. And then here, surgery. I think I had 4 or 5 that went to ICU. And a few go to a med surg unit. And then home health again. So that's when I didn't have site clinicals. They wouldn't let me in, so I did night clinicals. And the only requirement going back into the hospital in fall of 2020 was a mask. They wear a mask all the time. Idabel at McCurtain County, they never had a hospital mask mandate the whole time. Choctaw Nation at Talahina had an N95 filtered mask requirement. And the insight to that and the Choctaw Nation got so much PPE. My husband was part of delivering that, and they had to take truckloads for days, and they put them in a storage facility in Talahina. They got a ton. I don't know, but they were not concerned about us coming and using PPE.
They were handing it out.
Oh, every person who came in, every person. And again, I only know that because my husband's like, oh, we have a truck just for Talahina. Like, we have nothing else on it.
Oh.
And then our small little public nonprofit owned by the city here was like, your students can't take care of any, not only no COVID patient, but no patient that uses PPE, because if my student goes into a COVID room, I have to go. So you're not only using PPE for that nurse, you're using 2 more sets of PPE. And the one thing about PPE is every time you go in a room and you leave, you take it all off, you get brand new. And for an ICU nurse taking care of a COVID patient or 2 COVID patients, you could go through easily 30 sets of PPE in a shift. Easily. And it's just not feasible. And at that point, it had to be in the summer. I got an email from my boss that was from the president of the college that any PPE supplies in our clinical simulation labs were to go and give it to the closest hospital and donate it. So we went and gave everything we had. So we didn't have any to give to our students to go in the fall because we had given it all to them.
And there's still just a massive production shortage, right?
Oh, yeah, because nobody worked because they shut everything down. And then when they did start working, you know, the demand was so high. So for a while, and all this time, nurses that I've taught for any of the years that I had been teaching, it wasn't just I just would send out messages on Facebook like, listen, this is not normal. Nothing about this is normal. So if you need to talk, you need to vent, or you need, what do you need? Mm-hmm. Like, I'm not in it, but I can help you. My husband would just look over and I'd just be crying, and he was like, it's like they need a neutral person. They need a neutral person. Because we live in southeastern Oklahoma, and not to get into politics and religion, that is not what this is about. But there are a lot of people who are just very nonchalant about things and had opinions about things that they don't even know anything about, which seems to be rampant these days. But
so the sort of disbelief in...
So they couldn't go up to their family and be like, I'm taking care of this dying person. And they're like, well, it's not COVID. It's not coronavirus. That's, and they're seeing it.
Yeah. But then in their community and in their homes, often hearing it's not real.
Yeah.
It's or a government conspiracy.
Or it's just like the flu. That was a big thing at the beginning. It's just like the flu. And then they were giving them N95 masks, but they could only have that N95 until it fell apart.
Yeah.
And then I'm here teaching them like months before. Every time you go in and out of a contaminated room, you change masks. That was a big thing that was all over. Again, why I couldn't watch the news, because I would just cry. So I'm like, that's when I call my boss. I'm like, we're sending them out. And in theory, the hospitals are there to protect them, protect their workers, to give them what they need. And they aren't able to do that. Mm-hmm. So we're just sending them out to get COVID while taking care of COVID and sacrificing their life and their family's life to take care of COVID without proper protection. Like, that doesn't sit right with me at all. It doesn't sit right with me. So I had lots and lots of long conversations, and then I would go up there, and so then I started clinicals in September, fall, at the hospital. It still wasn't too bad, but there were some, and we get done with clinicals early November, because we do finals and we have a lot of stuff to do at the end of the semester. And by December, when I was looking, like right now I look towards spring clinicals and things, it was so bad. I called my boss. I said, I can't. Because when they do that internship, you have to ask other nurses to take a student. And that's the big thing that I was always hated doing clinicals in fall of 2020, because the nurses were so stressed out. It was like, hey, can you teach a student or take a student? And they were so helpful in all that. And I will say that it helps because we're small and I've taught all of them. At this point, they're like, oh, Miss Spiegel's asking me to help. Like, she wouldn't do it if she didn't need it, But we cut down our clinical groups very small. We used to take 8 second years at a time. Mm-hmm. We were down to 5 or 6 because we didn't want to overwhelm the system. But then nurses know if you don't take student nurses, you don't have nurses. Like it's a cycle of life. So I cannot not bring them, but then I would just walk up there and they would just have all their stuff on and their face would be so red. And then they would just be like, I only lost 2 people this shift. They used to not lose 2 people in like a month or a long period of time. And then they would call codes overhead, be like every hour or 2 in a small rural hospital. It's weird. It's weird. And their brain changed. I could tell their brain changed because they couldn't mentally and emotionally function anymore. And I had one student come, she showed up and waited for me at my office door. She had gotten off night shift and she was there. I usually get there about 8 or 8:15. She was there with coffee and she was like, hey. And I'm like, hey, so glad to see you, you know? She comes in, she sits in my office and she just like sits there. And I'm like, what's going on today? And she's like, I don't think I can put more bodies in black bags. So COVID bags are different. They're black bags. And she goes, we stacked them on top of each other in the morgue last night because our morgue isn't that big. And they're full. They're full at the hospital. They're full at the funeral homes. And the funeral homes were behind because they were trying to like space out all the funerals. And then people were waiting because they kept thinking they could have a big funeral. And it's never just one thing. Like, it always is something else. And one of my students is house supervisor. And he's the one who's in charge of opening the morgue. And like, he's like, we have to like go through them because when a funeral home shows up, there's so many in there, we don't even know. And anyway, so she sat down, I said, you know, this isn't normal, right? Like, it's not normal. You've seen more death in 6 months than I've seen in 20 years. So I want you to know that that isn't okay. And you need to talk to someone. Like if you've shown up here, you're in a place that you need someone. And I feel like the hospitals have come around a little bit more now, but back then it was just survival mode.
Yeah.
And in a dream world, I wish there was a counselor at the beginning and end of every shift that just was there. I got so many Snapchats of them just sitting in their car after, and they would just sit in their car. They couldn't even move out of the parking lot.
Yeah.
And then I had a student snap me when it got really bad. She lives in a big city in Florida, and she goes, I didn't become a nurse knowing that I had to walk through the portable morgue coolers to get into my job. And she would watch, and they would be just loading dead bodies as she came into work. So, those are just a few things that I think about from that time is that.
What did you tell them when they came to talk to you about that?
Oh no, I signed them up for counseling right there in my office. Like, I'm like, I don't know what to do. I know this place takes your insurance, and I know that they do televisits right now for counseling. Mm-hmm. So we just called and did that because they can't, when you're in a trauma, you can't mentally like I can't say, here's a phone number, call this, and then they send you paperwork and you're like, I can't print that out. Like, I can't do that. So I set a lot up with that. I would go on Facebook, like, listen, here's what I have. Here's what I have. I don't know how to, but I'll help you. I'll be the brain.
Mm-hmm.
So December and January was the worst here of 2020, 21. And that's when the vaccines started rolling out.
Did hospitals and hospital workers in southeastern Oklahoma take advantage of that pretty quickly? Was that what you noticed at least?
The first rollout was essential workers. I still think that's just a funny word.
Yeah, how do you feel about nurses and hospital workers being deemed this, and also came with that this public campaign for hero status, right?
Oh yeah, I forgot about that. Yeah, heroes work here and you're a hero, which works for about a month until they're asking you to do, and these are just stories from my students, I have nurse guilt. Nurse guilt is weird. It exists. And I'm a nurse, I should be taking care of COVID patients. What am I doing? Why am I teaching when I need to go out and do something? And my boss is like, if you don't stay here and teach, I can't find anybody to come take your job to teach. And then you're doing your part. Of course she needed me to stay.
Oh, but it's also true. Right?
Yeah, but it's kind of why am I not doing something? But then as it went on and people were out and then people would get COVID and then your unit would be short. And then, then they were working overtime and then they started paying them more for overtime. They're like, oh, well, I already do it 3 days. What's another day? And then what's another day? And then they got burned out. And then when you're in a small community, but you're from here and they start taking care of their own family members and they start taking care of their friend's mom and they're it's not just some person.
Mm-hmm.
It's too small here for it just to be some person.
Mm-hmm.
And then they got, the ICU was full. They were making decisions about ventilators. I don't know if you remember that vaguely, but whole state.
Yeah, there was there just weren't enough ventilators for people who needed them with one of the sort of pieces of COVID, right?
That was one phone call I got from a student. They're like, how do you decide whose life is important and who's not? How do you decide that? I said, I don't know.
Yeah.
And they had this big, all the hospitals have a status board. There's only 2 ventilators left in the whole state. And just because you have a ventilator doesn't mean you have a bed. And doesn't mean you have a nurse or a respiratory therapist to run it. You can also have things, but you have to have people to do it. Some places had beds. McAlester had beds. We had 30 empty rooms on a unit that isn't used anymore. It's just closed off. But if you don't have nurses, it doesn't matter. You don't have beds. And they were taking care of their family members and nurses, their own. And nobody wants to do that. And the ICU got so full. And then they couldn't transfer. You couldn't find anybody to transfer to. Then they were overholding them in the ER. And let me tell you, ER nurses are not ICU nurses. They're not. And then you got different doctors down there. And then in the medical record, you have to make sure you're charting as an ICU. And then you have to call this doctor. Even though you have a doctor 2 feet from you, they can't give you an order for this patient. that's dying, but this doctor is in a COVID room coding someone, and then you just feel helpless. Because you can't. So, December and January were really bad. We got vaccines. I don't even have a generalization for vaccines because I found it to be so different. I want it to be like the older generation ran and got their vaccines, or this kind of nurse went and got their vaccine and this kind didn't. I don't even have like a generic statement to be. I do know some nurses went and got it and hid it from their family because they didn't want to deal with the backlash of getting it.
So with the vaccine coming, was there a sense of like hope, or was there that tension because of so much mistrust of just all of it, right?
It was kind of a weird thing because I do think that December and January were so bad because Thanksgiving happened. Everybody came together because
why would we not?
What?
Right.
I mean, it was your chance. It was your chance. But anyway, we got together. And so then it just trickled, and then people got it. Then they were all together for all the Christmas parties and the, whatever. And then Christmas happened, and then New Year's Eve happened. And so all the transmission of COVID just ran into January. Well, I would have to go back and look at the Oklahoma Health Department numbers, but it eased up in February. I think just because people weren't together as much, and the people who wanted the vaccine and were waiting for it got it in January. I think one of our nursing instructors was one of the first ones in Idabel, and she got it the first week of December. Only because she had COVID in November, and she was like, I know that was horrible. I would have taken the vaccine in October. She wasn't anti-vaccine. She just didn't have the opportunity to get it before she got COVID. Right. I think that the people I know that got COVID in December here, they kind of went both ways. I have something I had COVID, so now I can't get it again. So before, we didn't know about variants.
Right.
And they're like, well, I have immunity. I had it, so I'm good. And then there's some people who are like, that was horrible. Please vaccinate me. Yeah. Give me all the vaccines. I don't care. So there was kind of a split between that.
Mm-hmm. And it sounds like, you talked about this earlier, there's a sort of family pressure of people who are working on the front lines and then having to come home to situations where it's just everything you see, that you say you're seeing is not real. It's, it's exaggerated. And
and just views that are not based in fact. Perceptions and I would say, I guess, mainly the ones here are government conspiracies about what they're putting in your body. Then another whole sect of religious, I don't know that. I don't understand that part. I don't know if the religious is God doesn't want me to, or that it harms my body. I don't understand that part of what the behind, just because so many people have a different reason. Mm-hmm. So,
do you think most of that is coming from just talking to each other, or do you think it's a lot from social media? Do you think it has something to do with news, the way that news channels have handled?
I have several different thoughts. I think social media news is definitely something that is heavy on that. I also think that we're in a whole new frame of mind and state of mind in America that is it's about me and my right. And that has developed over decades, that this is the first time that this generation per se has been able to do that. And so that's what I've seen is it's my right to say yes or no. And I don't know, maybe it's the self-centered, selfish, they don't see the greater good. It's just what's for them in the moment. It's very for them in the moment. And not, which public health is based on the greater good. It just is. So, and I've had to talk, we haven't got this far. Oh my gosh, I'm so sorry. But we haven't got this far into where we are today with mandates.
Yeah.
And
well, it's not a very far walk, right? Like, so from the vaccine to people choosing to get it or not choosing to get it for all those different reasons.
Yeah.
Right? And then I think the next chronological space is people started getting the vaccines and we started, I think, seeing a decline. And then the summer came.
And it was fantastic.
And then we had a new variant,
Yeah.
Delta, which was 100 times more
It was way
viral
worse.
load or whatever it is, more contagious than that original strain.
Yeah.
So, I mean, like, how did, like, you know, so you feel like, do you feel like the nurses that you talked to and that you've worked with and that you were teaching at the time during that time period, like, yeah.
In the spring of 21,
Yeah.
so it was bad, December, January, February, the state and the State Board of Nursing and the education director under the State Board of Nursing and our accreditors were very much part of the students need to be a part of the vaccine clinics in your area. They wanted us to show that we were a part of the community and that we were the ones. So, my director was very much a part of that and making sure that the students did that because we were busy trying to stay in the hospital with smaller students. Like, she took everyone in Wilburton and McAlester and did theirs. Now, Ida Bell, they had their teacher down there help with that. And so I would say most of those students got theirs probably. It's just very strange talking to students because some were like, I have some that got it in December. Like, I'm like, I don't even know if you were like meeting the criteria. But at that point, they had so many in southeastern Oklahoma. They had extras. So you would see, like on Facebook, I follow Pittsburgh County Health Department. They're like, okay, we did our flu clinic today and we have like 72 doses left over, you know, that weren't the 65 and older or the whatever. And so I have several that got it. And then it's just so weird. It's like either they're all in and they got it or they just didn't at all. So those students graduated. The summer was great. I'm like, yes, we're going back to normal. Like, I'm ready. I'm ready for fall 21 to be normal. I'm not going to have to mentally be exhausted from trying to figure out how this is going to work. And the hospitals kind of seemed like surgeries were back. So we're doing hip replacements and knee replacements and, you know, people are staying in for pneumonia and cellulitis and COPD exacerbate, you know, like all of what you would consider a normal thing.
Yeah.
And then August comes and it is just full on Delta. They are maxed out again. I'm talking to nurses. They're like, I'm just going to have to quit. Like, I'm going to have to quit. I cannot do it again. I cannot stack body bags. I cannot use WebEx or telecom to call these families. And that's the part that I have just listened to nurses a lot. And those last phone calls and last FaceTimes wore them out. They wore them out. That's stuff you don't do as a nurse. Like, in general, I've never taught that. Like, how do you comfort a family on FaceTime when that's the last time they're going to see them because you're about to vent this patient, and the likelihood of them coming off is like 1%. I don't teach that. That's not in my curriculum, but it is now.
I was about to say, is it now?
Yeah, it is now. But I didn't, when I signed up, I was like, oh yeah, ICU, broke care, ER, yeah, you'll just have to FaceTime their family. And the stories that they tell me about those conversations, and then they zip them up in a body bag.
Yeah.
Those are the things that are too much for them. For me, for anyone. But to do it every day, you clock in and you clock out, and you do it multiple times a day. So it came, and I was like, oh my gosh, we're just gonna do this again. I have to do it again. So then they didn't let me into psych again. Or they said I could come to psych, but there were lots of rules. I could only take less students.
Yeah.
Oklahoma at this time is all the mess about mask mandates. There's injunctions. The state facilities can't require a mask mandate. My kids have always been on board with putting the mask on. Like, my son wears a mask now and he doesn't even have to, my youngest son. He goes, I don't ever want to be quarantined again. And so
But there was legislation that had happened in the
there was an
spring.
executive order in June or
about-
July.
Yeah. About not being able to require masks for.
Or vaccinations. Was that vaccination in that one? I don't remember. But it was masks for sure.
Yeah. It was definitely like you couldn't require masks.
In a state facility.
Yeah.
Or a state property or something
Including
like that.
education
Yeah.
spaces, yeah.
So, of course, August, when everyone goes back to school. So for 2020, we had lots of rules about social distancing, about Zoom. We had to provide a Zoom link for every single class, because if they were exposed, felt sick, or were in quarantine, they had to be able to be in class on Zoom. So we were very free in 2020 with Zoom classes. And you had to we had mask mandates on campus. They were moving people into big auditoriums. Eastern's not that big. Like, our biggest class is probably history, that has like maybe 40 people. Like, they were moving these classes into our auditoriums on campus and giving the teacher a laptop to Zoom from, because there's no like technology equipment in there. And so we went from, I was pretty comfortable with going to work. I wore my mask. We had enough room. All over campus, plexiglass was like, I felt fine. And we were gone that December, January for break anyway, when it was really high. And I did have students that had COVID in the middle of that. And sorry to go backwards just a little bit, because I forgot about all the 2020 school mandates.
Yeah.
Is that we were so flexible, and my nursing students live on the edge a little bit, because they're like, are we failing? Are we going to make it? Because it's hard. And to get COVID in the middle of all that, and we don't stop. We can't stop. But I had a few students get COVID, and I'm like, listen, you take care of yourself. Nursing school will be here, and we will get you done with what you need to get done when you're better. My other big thing is in the orientation of fall of 2020, it's like, if you feel sick at all, if you think you might have been exposed, if at any reason, just tell us. We will make it work. We are here to get you through nursing school, not kick you out of nursing school. So you just have to tell us. And everyone was so good about it. All the students were so, so good. And it's like we understood. Everybody understood. You don't want to get anyone else sick, because you'll wipe out a whole class if you come. Well, then that executive order came through, and it was just like a free-for-all in August. Like, the people who wanted to wear masks wore masks, but then it was like, I don't have to wear a mask. And I'm like, no, you don't. Like, we're not going to talk about it because there's nothing to talk about.
So you had nursing students who were like, I'm not doing
In the
this.
classroom.
In the classroom.
Now, in the facilities, which we have a whole separate thing for facilities, which is normal. And because this facility, you have to cover your tattoos. This one, you don't have to cover your tattoos. This one, you can
Yeah.
wear your hair in a bun. This one, they're so different. But all facilities except Idabel were mask required. And most of them are already in the hospital. By the time they come to second year, they can test in Oklahoma for their LPN, or they're an extern or intern or an aide or something. No one ever balked about anything, and they really were good. There were just a few that kind of brought up, you can't make me wear. I'm like, yeah, no one said you had to. Like, I understand. I did not feel as much safe in August going back without the mask mandate. And that's when we started. We did not have a COVID vaccine mandate by any of our facilities in August, but we started taking their COVID vaccine information. Like, if you got it, we would like to know. Like, we can't make you share it with us. But we felt more comfortable, I felt more comfortable sending a COVID vaccinated student down to ER to help and learn than a non-vaccinated student. I had a student who's, I'm trying to decide if I should share this. It's kind of her personal information, so I'm not going to, but she had a lot of COVID related situations happen in her family this fall. And I was just like, you have to take care, again, this is where we're at. We're in COVID world, but you have to communicate with me so I can know and I can help you. Because if you don't, then I don't know, And so then it starts getting real personal when, again, people's people start doing that. But it waned off a little bit at the end, but it never fell like it, and the numbers never fell like they did in the summer. Mm-hmm. And that's when all the nurses started quitting and taking travel jobs. They were paying so much. I don't know if you've heard this.
Mm-mm. So now that's what's happening.
Yeah. So now I can go up to the hospital and hardly not know anyone. Because when August came in that second wave, they're like, I will not do it again. I'm not a hero with a cape. You can't give me free pizza anymore. And you can't do that to me. I had a student who quit. I've had a student who's quit nursing altogether that graduated in spring of 2020 because they were a nurse in a critical care area for a year and cannot mentally do it again.
Yeah.
When COVID came around, quit.
Yeah.
Won't do it. And I had a student who did a lot of overtime and was trying to get a hold of her supervisor to take her PTO. And they're like, well, we don't have anybody to replace you when you take your vacation. And I looked her straight in the face and I said, any facility that tells you that, you do what you need to do. But I'm telling you, they're here for them and not here for you. Yeah. So they made a decision to quit. So travel nursing has exploded. They're paying, some places are paying $6,000 a week for 4 shifts.
Oh my gosh. Are they not having to deal with COVID patients in those areas?
Yeah, they are.
So what is the difference?
But they're already taking care of COVID patients. So you can take care of a COVID patient for $18,000 a week. Mm-hmm. Or you can do it for $6,000 a week and pay. It's just, yeah. I met with a student. We do averages we do graduation surveys. Are you running out of?
No, I just want to make sure still.
We do graduation surveys. It's part of our accreditation. We do them every year. I do them 6 months post graduation
Yeah.
for pay. And I would say the average pay lately has probably been 50 to 60 just graduating.
Yeah.
This year we asked what they were making and if they got a bonus. They're way up in the 60s, 70s. And this isn't a travel contract. They're just working at a hospital. I had students get $20,000 sign-on bonuses for a 2-year contract. 10 years ago, I had students that couldn't find a job because there weren't enough nursing slots.
Yeah.
So now you have people traveling. And used to, even when I graduated, traveling was like you'd have to go to California or you'd have to go to wherever. No, they're traveling to their own town. There's tons of TikToks out there right now, and it's just nurses they're just talking. They're like, they offered me overtime for time and a half, but the traveler sitting right next to me is making $80 an hour, and I'm making $30. So they literally quit, turn in their 2 weeks notice, and are working at their same place for $80 an hour, where they already know the system and everything. So I do see nursing changing because of COVID. They're going to change to contract employees. They'll probably, I'm not saying it will happen, but right now they're basically, nurses aren't a part of the employer part. They're contracting themselves out, and they can go and do whatever they want.
Are there, besides salary, is there benefits with, like, do they get the time off that they need? Do they able to regulate that as well?
And they're not going to call them for extra. So if they contract for 4 shifts a week, which mostly are 3 shifts are full time. But if they contract for 4, they're not going to call and pay them. They get their other 3 days. And they don't have to feel guilty. Remember that nurse guilt thing I talked about? And in the beginning of this, I talked about the people who got ran over that would do anything. Those are the people that have suffered the most because the hospitals used them. They used them and they ran them over and they burned them out.
Yeah.
And they went in and they called it. Every time they called them, they went in and they worked. And they burned them out.
What do you hope that hospital administrators are going to look back on this and make changes for? Like, what do you hope that they learn from this?
I do think some hospitals are doing it right. I do think that. I think that we don't see that as much here in southeastern Oklahoma.
So what would be an example of a hospital doing it right?
There's a hospital nearby that is, if you do a 4th shift, you get $20 more an hour. And then if you do 4 of those, you get $1,000 bonus. So they're making that $80 an hour. It just looks different. So on that 4th day, you're getting time and a half plus $20. So if you're making 30, you get 45, so you get 65. On that 4th day, you're getting 65 an hour, and then you get $1,000 for 4. So $250 for each of those shifts on top of that $65. They're making it happen. They're getting close to that travel pay. And then it's on the nurse. Like, if they don't want to do the 4th shift, they don't have to. Some of the hospitals are doing internal contracts. So they're moving you over and they're paying you. Those contract travel agencies, they're paying the nurse that, but they're paying the agency even more. So if they do an internal contract, pay you the $85 an hour, they're not paying the overage fee for the agency to find you, to move you there, to do all that. So the biggest slap in the face is there's a TikTok going around right now that one of the major hospital systems in America right now gave their employees Play-Doh or something for like Christmas. And it had like a catchy saying about molding your life or whatever. And it had all the nurses just throwing it in the trash. Like, this is a new generation of nurses. You've used them. They've lived through a pandemic now, and they're not going to take it from you anymore. I feel like that's what's come out of it. If you're going to use me, then you're going to pay me. And that's what I want.
Mm-hmm.
I don't want your pizza party or your fruit tray, which they'll take it, by the way.
They'll eat the pizza. Got it.
And they'll one day I just went to the store and got all sorts of different things. Dr. Peppers and Monster drinks and Red Bulls and tea and whatever. They want to feel appreciated, but feeling appreciated isn't enough when you're worried you're going to take COVID home to your baby. You have moms that have newborns that are working COVID. You have people that are worried about taking care of their mom and dad. Like, I had an adjunct instructor. She was like, I can't do clinicals because I am fully the one in charge of caring for my elderly parents. I get it.
Yeah.
But the people who are working on the front lines, who are concerned all the time about doing that, you can't put a price on that, or they will put the price on that.
Yeah, but it's more than pizza.
It's more than pizza. And a thank you pin that's fake gold from China. That used to be enough. And the inflation has changed. Cost of living has changed. And so when you're talking about trying to find someone to watch your kid while you work, it's like, oh, okay, well, your kid might have COVID because you work on the COVID unit. I don't want to watch your kid. Like, you're having to find someone who will take your child because of what you've chosen to do.
Mm-hmm. What about the mental health support? I know you've talked some, like you said at one point, if you could make it happen, they would have counseling before and after every
shift change.
Do you see any changes or any acknowledgement
I do know
of that?
I don't know about other hospitals. I do know that finally some emails went out about you get 5 counseling sessions free with our insurance. Like, yeah, but hello, it's fall of 21.
Yeah.
I just always feel like America's behind. And that's a very general statement, but I'm just like, why are we behind? Why are we behind? Why is that not the first thing that we're doing? And I don't know anything about military or combat or anything. But my best guess and understanding would be that these nurses that worked, and I say ICU a lot, there were a lot of people who were on COVID units that weren't ICU, but they had to treat it like an ICU. Some of the nurses I know were med-surg nurses who worked on COVID unit and felt helpless because they weren't in an ICU and they couldn't get a doctor in there fast enough and they needed help. But it has to be PTSD. Like, this has to be PTSD. Because the nurse I know that quit said, I don't know how to take care of a patient that's not on a ventilator. I don't know how to take care of a patient that talks to me. Never since graduation had taken care of a patient that wasn't on a ventilator. Quit. What do I do? What do I do when I'm not putting people in body bags? When I'm not, like, a normal oxygen should be 92 to 100. The nurse I knew that they wouldn't do her PTO or whatever, she said, do you know 78% is a good number to me? Like, that's how my mind has changed, is that I'm happy with 78%. She said, I have to remind myself that's bad. She said, my mind is messed up. My mind is messed up. Nurses can't take care of patients that talk to them, and they don't know what normal is anymore. And that is PTSD. And if they don't take care of them, they're just still out there working. They're still out there clocking in, clocking out, taking care of patients. And then you're going to have this big way that they're either not going to cope, they're going to choose other ways to cope. The decline is hitting, and it's going to continue if we're not proactive. I don't want to hear in 10 years about high suicide rates of nurses and healthcare professionals that worked COVID. That's my worst. That's the worst thing I could think of, is that we weren't there and we didn't give them what they needed. And we just said, we'll pay you more. So can you work another shift? Instead of saying, you know what? We're going to pay you for 2 months while you take a big break and you go see a counselor every week for 8 weeks. We're going to pay you. We're going to pay you 2 months to go take care of yourself so that you can help people for a long time.
Mm-hmm.
But that's what I want.
How's recruitment right now?
It's good for southeastern Oklahoma because people have lost their jobs because of COVID. Things have shut down.
Mm-hmm.
And you want to know what we have? Healthcare.
Yeah.
And so, in all reality, it's not bad. People are still signing up for nursing school.
So what have you changed in the way that you prepare them, knowing that we're still in it and that they're going to walk out the doors to be in the middle of it?
I think that a lot of them will not work in the hospital. When I talk to them, and a lot of alternative nursing jobs have come out of COVID. I also think it's just in them, like some of them are like, man, I want to work ICU. They don't care. I just think that's the way we're made, like me, I would still work ER. Even when it came, I was like, I'll go do it.
Yeah.
And so I just think some of it is just because they've lost their jobs around this area. There's a couple of factories and things that have shut down, and they're like, well, the hospital stayed open and I can go anywhere, or at least travel. The money for the travel is out there. And so people are like, man, if I can make $6,000 a week for 13 weeks and then come home and take care of my family for a year. I mean, they can make a whole salary in 13 weeks that they make here and take care of their family.
Mm-hmm.
And that says something for down here. It just does.
Yeah.
And so with the vaccine mandate, some of them went and got their vaccine. Most of them are religious exemptions.
Mm-hmm. It's the federal mandate for
Yes.
healthcare workers.
Yeah, and the federal mandate comes from CMS, which is Medicare, and they won't pay them.
Right.
And none of our hospitals here will function without federal money. They won't stay open. And so they have to. They have to mandate it. And there's a lot of people down here that don't believe in vaccine, or this vaccine. And
Are they leaving the hospital system instead of getting it, or are they really just filing the religious exemptions?
For our students, it's kind of, they've made it all this way. They have one semester left. So I feel like they're just doing it because you've wasted your time, your money, and you should know if you want to be a nurse by now. If you want to be a nurse, and that's what we've kind of told them. And I have a lot of early 20s students, and this is the first time they've really had to make a decision. A lot of it is not the vaccine itself. It's the making the decision on your own, I've found. So I just tell them, like, what would I do? What should I do? I'm like, no. That's hard as a healthcare worker nurse, is to be neutral. And I'm not neutral. I always tell them that you should leave my class, my year, not know my religious affiliation, my political affiliation. You do not know me. You know Miss Spiegel, your teacher, who will do anything to get you through nursing school. Mm-hmm. So they come in there, and I know what I want to tell them. But they also have to figure out their life, because this is one of many decisions you're going to have to make as a nurse. And you're going to have to make it. Yeah. So you make it, and then you live with it, and you go on. I had one student who has a religious exemption that I would fight to the death for her religious exemption. I would. She lives that life. She only got a few vaccinations to get into school. They have she has documentation of her whole life. Her great-great-grandfather, they have a specific religious sect, and she's the most vaccinated person in her family, and she only got them so she could come to nursing school. And so, that's what that's for. Mm-hmm. That's what America's for, is to protect her. I believe that. But whoever just went and found whoever to sign a paper, I'm not okay with that. And some of the facilities are refusing their exemptions, which they're not happy about. And I said, hey, you roll the dice. This is what I told you. You want to do it? You go do it. We roll the dice, you see, and then you make your decision as we go. Mm-hmm. At any time, you can go get vaccinated, and we can be done. So whatever you want to fight for, that's what we're here for. That's why we're in America. And I do think it was, this year they had the Oklahoma Nursing Association conference. I love taking students. I've went with the students almost every year that I've been there. I love being the faculty advisor that takes them, because we need outside vision. They need it here. They're from here. They're stuck here. Not like physically, but mentally, they get stuck in a pattern. I had a very frank conversation with a student who got up in the middle of a general address at the convention. I thought she was sick. She was not sick. She thought she was being forced about information about COVID, and they were lying. And we had to have some great conversations. That's what I'm here for. That's why I'm in education. Let's challenge your point of view. Let's do it. I'm here for it. I'll sit through it. We'll do it. And I said, okay, I see your perception of that. This is my perception. I was in the same room. He was a national speaker, nurse, lives in North Carolina, very active in Washington, D.C., and stated that most nurses are pro-vaccination in America. It is true. That is true statement. He had data to show vaccinated healthcare workers in America as of the last week of September of 2021. And she's like, he's lying. I'm like, no, he's not. Because I want you to be challenged, because I agree that in southeastern Oklahoma, that is not the case. But you have to be willing to see the big picture. You have to. And that right there is one of the reasons I love being a nursing instructor. Did we answer all the questions?
Oh gosh, I think so. Is there anything that we didn't talk about that you wanted to? I know it's not over. I mean, I know we're it feels like sometimes that we're,
Man, I was so hopeful last summer.
I know.
We went to Utah last summer.
Yeah, I'm glad you got to do that.
I know.
I know we've done some things too.
Yeah.
I thought,
But I just,
yeah.
I feel like in the hospital, I felt this semester I did nights again. Even after August and September, it didn't feel as heavy. I don't know the word, but the people in southeastern Oklahoma who want to get vaccinated have gotten vaccinated. The nurses who want to be vaccinated have gotten vaccinated. So there's the hope of herd immunity. I think that's what it is. There's just the hope that it won't ever be as bad as the first huge impact here in southeastern Oklahoma, December of 2020, January 21. That's the only hope that I see.
Yeah.
Is that that's it. This last wave that started in August and is still going on, it probably peaked in September and has never really fallen again. And it will rise again with Omicron. The ones now that are the hardest are, you cannot, and this is what I want to tell my students, is you cannot judge the people who took the vaccine versus the ones who didn't. Because there are nurses out there, and I understand the mindset is, why are you taking a vent? Why are you taking a patient bed? Why are you taking up space if you decide not to get the vaccine? Like, you should just stay home because you've made your choice. I understand the perspective. I do. Because again, she said, how do you decide who is worthy of medical treatment? I don't think that in modern America we've had to make those decisions before. Mm-hmm. But I have to remind myself and them, we take care of patients with AIDS. We take care of patients that have chosen to ride motorcycles at 120 miles an hour. We know it's not safe. We know they didn't wear a helmet, but we do it. We take care of everyone. We don't ask questions. I mean, we ask questions to take care of their immediate medical and health needs, but we wouldn't have a job if we were here to judge, because you don't get to pick. And so that's what I see going forward is you have this vaccinated versus unvaccinated. And even me, when I hear about people like, oh, were they vaccinated? Like, I kind of just want to be like, oh, please be vaccinated. Because studies show that you're less likely to be hospitalized and way less likely to die. And that is what I hate moving forward, is that. And here, there's been some young people die in our area that didn't have to die. And I do think those situations, although how horrible they are what change people's perspective. Like, and then their families, like, if we could go back and all be vaccinated, we would do it in a heartbeat. And that's the worst way to be motivated to do something, is when something tragic happens.
Yeah.
Here we are.
Here we are.
Walking slowly and gently and quietly into 22.
That's one way to put it. Right?
Like, don't disturb.
Just keep at it. Oh gosh. Well, I do appreciate. Gosh, I appreciate your time, and I really appreciate you thinking about this. You being so thoughtful in how you shared sort of this. It's a large swath of perspectives, right, that you come up against. Mm-hmm. So I do think that is helpful.
And it's just ongoing.
Yeah.
You may have more than you want.
No, it's awesome. I'm going to go ahead and stop it.